Welcome to Med Central. In this video, let's look at the pharmacology of the beta-2 agonists, which are used in the treatment of asthma and COPD. Beta-2 agonists. These are used as bronchodilators for COPD and asthma. Asthma is a reversible airway obstruction due to smooth muscle contraction in small airways due to inflammation of the bronchi. It also causes airway remodeling. Chronic obstructive pulmonary disease. There is a limitation of airflow that is not fully reversible. The abnormal inflammatory response in small airways and alveoli causes excessive production of mucus, which obstructs the airways. So, there are two mechanisms for treating asthma and COPD: bronchodilators for dilation of the airway, anti-inflammatory drugs to prevent inflammation. Beta-2 agonists are bronchodilators. Beta-2 agonists are classified by the onset of the action and the duration of the action into three main categories: short-acting beta-2 agonists, long-acting beta-2 agonists, ultra-long-acting beta-2 agonists. Short-acting beta-2 agonists act as quick relievers, while long-acting beta-2 agonists provide long-term control of the drugs. Short-acting beta-2 agonists. Rapid onset of the action within 5 minutes. Peak effect in 30 to 60 minutes. Duration of action of 4 to 6 hours. These drugs are given as a quick relief of symptoms. Examples are salbutamol, terbutaline, levolbuterol, perbuterol. These can be administered as metered dose inhaler, MDI, dry powder inhaler, DPI, via nebulizer, intravenous, intramuscular, subcutaneous, and oral. Let's consider about adverse effects of the beta-2 agonists. Tremors, palpitations, muscle cramps, and hypokalemia. Long-acting beta-2 agonists. Prolonged duration of action when compared with the short-acting beta-2 agonists. 12 to 24 hours of duration of action. Examples are formoterol and salmeterol. Formoterol is a full agonist and has a quicker onset of action. Salmeterol is a partial agonist and has a slower onset of action. Long-standing beta-2 agonists are not used as monotherapy. These are used as maintenance therapy for asthma and COPD in combination with glucocorticoids. For example, salmeterol with fluticasone and formoterol with budesonide. Route of administration is metered dose inhaler, dry powder inhaler. There are some adverse effects such as palpitations, tremors, headaches, and metabolic effects. Ultra-long-acting beta-2 agonists. This category has the longest duration of action, which is up to 24 hours. It has an additional benefit of being once-a-day dosage. Most of the drugs in this category are undergoing research. Examples are indacaterol, olodaterol, vilanterol, formoterol. These drugs are administered as dry powder inhalers. Let's have a look at some adverse effects of the beta-2 agonists. Tachycardia due to vasodilatory effect of peripheral vasculature and subsequent decrease in cardiac venous return. Nebulized and oral beta-2 agonists are also associated with an increased risk of cardiovascular death, ischemic heart disease, and cardiac failure. Cardiac toxicity in the form of arrhythmias, cardiomyopathy, and ischemia has been correlated more strongly with older generation beta-2 agonists. Beta-2 agonist effect on the membrane-bound NOP/KAT leads to the inward shift of potassium into the cells. This causes hypokalemia. Several studies also indicate hypoxemia and hypercapnia, which leads to the cardiotoxic effect of the beta-2 agonists. Beta-2 agonists show tolerance with prolonged use. This is due to desensitization of the receptors, leading to reduced action of bronchodilation and anti-bronchoconstrictor effects. Genetic polymorphism, the degree of airway inflammation, and the route of administration also affect the tolerance of the beta-2 agonists. This is the pharmacological basis of the beta-2 agonists. Thank you for watching. Subscribe if you find these videos helpful.